Hello, my name is Ibrahim Adedokun. I'm a software developer, and today I'll be walking you through how to build an AI agent using BimpeAI. BimpeAI is an API-first platform that allows you to build agents, voice agents, and chat agents using their SDK. They have the Python SDK and they have the JavaScript SDK. So for this use case, I'll be using the JavaScript SDK. I'll be building an AI receptionist agent for an healthcare company called Alafia Health. So the goal of the receptionist is to talk to the user, to the client, potential client, collect their important information, connect them to the right doctor, and allows them to schedule an event. So it collects information. It also has emergency keywords. It recognizes that, and then it has a calendar integration. It allows them to book an appointment using Calendly. So the prerequisites are BimpeAI account. So you need a BimpeAI account. You need the API key, which you can register by going to bimpe.ai. You need Node.js installed because this is the JavaScript SDK, and of course you need to install the SDK. So the first thing to do is we need to build a workflow. So you can think of a workflow as a set of instructions, the guide, the do's and don'ts for your agent. So the first thing to do is you import the BimpeAI from the SDK and then you initialize it by passing in your API key. So you create the workflow by calling the bimpe.workflows.create and then you pass in a name and importantly the system prompt. It is in the system prompt that you design the personality, the operational rules, the do's and don'ts of the agent. So after that, you can create the agent by connecting it to the existing workflow. So you create an agent by giving it a name, a description, and a workflow ID so that you know what workflow to use. And a good thing about BimpeAI is for a good developer experience, you can add the idempotency key to ensure that when you run the script multiple times, you don't create multiple agents. You only update the existing one. And then you can add knowledge bases. So knowledge bases are just like the name sound, you add information to the agent so that it knows what exactly to follow and it doesn't take things outside of the box. So in this case, we're adding the clinic directory. So two doctors that we have, their specialty and their availability, and also the HMOs that we accept. So the next thing to do is we've built the workflow, we've built the agent, we've added knowledge bases, is to connect the channels and integrations. So the channel is the interface where our actual clients will connect to it. And on BimpeAI, if you go to your dashboard, there are a lot of supported channels. There's WhatsApp, Instagram, web chat widget, and there are also voice agents, the web voice, telephony. But for the sake of this use case presentation, I will be using the WhatsApp and then the web widget API. It's quite easy to do. You can just click on connect and then you're connected. Or you could also use the test code. For example, testing on WhatsApp, you could send this to this number on WhatsApp and you can test your agent live on WhatsApp. So once you're done with that, you can verify your channels and integration. You can run this code block and you should see the log of your active channels and your integrations. And when you're good with everything, you can deploy and start testing. So you might think, why is this important? This is important because you have an agent that does heavy lifting of, liaising with the client. It collects the information and allows them to book the session. It saves human time, it saves human effort as well. So the AI agent does everything outside of the box. It collects the information and hands over to you, by you just visit your Calendly and you see that you have clients booked. So I will go ahead and this is the complete code. This is the script, and I can run the script by just running it with Node. So running it with Node, I see that okay, it is configured. I see the active channels because I already have web chat configured. I see my integration, the MCP. The MCP is the Calendly. It needs Calendly to create sessions or book appointments. So with that, I can go ahead to my dashboard and I see it. I see it's already live, and then we can start testing in the next video. Thank you. Okay, so now we're going to the second part of testing the Alafia uh, hospital. So Alafia Health Concierge. So here we could test on different channels that we want. We could use WhatsApp, Instagram. We could even use the test agent from BimpeAI. For example, on WhatsApp, you could send this code to the dedicated chat bot number and start testing. But for simplicity's sake, I would just like to use the web chat widget to test this. So you can set the status, you ensure that it is enabled, and then choose a color. For example, you could want to choose green for head, and then a welcome message, and just grab the script based on your configuration. So I already have that done in an index HTML file. Everything is connected. So I can just open the file in my browser and then start testing. So it's asking me, okay, this is Amina speaking. I should provide my full name and email address. I'll just say my name is Ibrahim Ade. My email is ibrahim@test.com, for example. So loading the information. Okay, it's telling me my date of birth and then my insurance. I just the date of birth is, for example, May 1, 1990, and my insurance is Reliance Health. Okay, she's telling me it has Dr. Emeka Okafor or Dr. Shadi. So let's just choose general practice, for example, Shadi. Okay, so it's processing that, and then we come back. So this has an integration to Calendly. I guess that is why the request is taking a while. Okay, it gives me available slots that I can use to book, and then I'll just say 10 a.m. for example. It's great. So processing that again. So it gives me a summary that, okay, my name, my date and time, my HMO, my booking link. So it gives me a link to book my consultation, and I can open the link on Calendly and then book the consultation for June 26th. So that is where it drops off. And then so the idea is that, so the idea of the whole thing is that it takes away the heavy lifting, the repetition of having a receptionist on the phone 24/7 expecting such messages, and instead just collect the required information and then passes that to Calendly. So the user books their appointment and they are connected to the doctor. So that is a use case in BimpeAI, but you could check out the docs at docs.bimpe.ai and then view the other example use cases you might find interesting or find useful. So that is it about BimpeAI. Highly recommended. So you could go to bimpe.ai, create an account, and then you can start building your agent. So that is it. Thank you for listening.